Thank you for exploring our series of short videos intended to provide practical information on oral health. These videos were developed with caregivers in mind, whether you are taking care of a loved one at home or a professional working in a care facility. These videos provide tips on oral care practices and include information on a range of oral health conditions. Please keep in mind that it takes many years of study to become a dentist. We are sharing some of the knowledge we gained in dental school and over the years of caring for patients. My name is Dr. Selvaggio. I'm here to help you understand how to assist others with their oral care when they're no longer able to self-care. The approaches you use in providing care will depend upon their status, both their physical and their mental. Let's talk about some conditions that might require your help for a person having effective oral care. The first thing is that people might have a limit to their physical abilities. For instance, they may have been in an accident, they may have had a stroke, and they have limited use of their arms and hands, so they won't be able to brush their teeth effectively. Another possibility is they might have some form of intellectual disability. They may not have the cognitive resources to follow instructions and properly maintain oral hygiene. Another possibility is the person might be experiencing some cognitive decline. As we get older, it is often common for us to have some inability to follow instructions and be able to complete a task successfully. Let's talk about some general guidelines for helping others. It's important to encourage self-care. This will allow them to have a feeling of self-control. It's important to be respectful of who they are. This means instead of entering a room and starting a task right away, you introduce yourself, you tell them what you'll be doing, and you do it in a respectful way. While they're doing this self-care, observe them to make sure they're doing a good job. Feel free to help them with their actual care, give them some words of encouragement or some tips. It's important also to have all the needed materials close at hand. This way you don't have to break the routine in order to get up and get something that you might require. Here we have a slide of a woman who's at the sink during her self-care. This person is able to understand what's being done and do an effective job. However, you should be there monitoring. If they need some help, feel free to go over to them, give them some words of advice and encouragement, or perhaps even help move their hand for them to do it effectively. This is called the watch me technique. This person maybe forgot how to brush their teeth, so the healthcare aide is showing them what to do. She then hands off the toothbrush to the person and they're able to do their own health care themselves. Sometimes a person is unable to get to a sink. Here we see a healthcare aide providing care in the chair. If a person is in a wheelchair, the proper technique is to go behind them, support their head with your shoulder, and use your free arm in order to brush your teeth. Occasionally, a person might be confined to their bed. In these instances, it's important for the person to be as upright as possible so that they don't choke and they don't swallow too much water or toothpaste. Here we see the healthcare aide moving the cheek to the side in order to get the toothbrush in effectively. Occasionally, a person may have difficulty in opening their mouth and keeping it open. This aide is using a toothbrush between the teeth to keep the mouth propped open and the other toothbrush to brush the teeth. It's also possible to use a rolled up piece of cloth in order to keep the teeth apart and do the job. Flossing is very important. About 40% of the gum-tooth interface, or where the gum meets the tooth, occurs in between your teeth. If you're not cleaning that area, that means that that area is not being removed from bacteria and plaque and can get gingivitis and infections. There are many ways of using materials to clean between your teeth. One way is using dental floss. Over here we see a healthcare aide showing the person how to use a small interdental brush in order to clean your teeth successfully. You should monitor this and give as much encouragement as possible. It's important that when you are giving instructions to give it in short, simple steps. Break it down into as many small steps as needed. For instance, instead of saying, "Go and brush your teeth, please," you could say, "Here's the toothbrush, let's walk to the sink. Let's put some toothpaste on the toothbrush." This way the person will understand the concept of brushing their teeth. You could also use the watch me technique where you show them how to do it by holding their hand and then they can do it by themselves. Please try to avoid elder speak or baby talk. Sometimes there's a tendency to speak to the person as if they were a child, and that's not being respectful. Also, you should avoid speaking to them in a high tone. Very often when we get older, we start losing our hearing in the upper registers, and they won't be able to understand what you're saying. Approach them slowly and from the front. This way they won't feel threatened by you and you won't surprise them. It can sometimes be helpful to use a hand mirror to engage them and show them the activity that's going on, show them how to brush their teeth. And if you encounter some resistance, you may need to do oral hygiene in a couple of sessions. So do what you can now, then come back later and finish the job. Alzheimer's disease is a neurodegenerative disease that causes 60 to 70% of dementia in older people. It affects our thinking, our remembering, and our reasoning. Usually this begins slowly, but then progresses over time. So at this point, there is no cure, but there are some treatments available. And you may notice some personality changes that occur over time. People with Alzheimer's disease can have fear and resistant behavior. This is because the part of the brain that controls those emotions is not kept in check by the higher functions. As an example, you may have a fear of dogs. If you see a dog walking your way, you notice that the dog is on a leash. It's a small dog, and the owner is in control. You don't normally exhibit the behaviors of fear and run away. However, a person with Alzheimer's disease does not have the higher centers of control, and they may feel very fearful in such a situation. Similarly, if you walk into a room and head towards them without introducing yourself, they may have the experience of having an initial fear reaction and may resist any treatment you can provide them. So what should you do? The answer is to approach them slowly, at eye level, smile. People will understand a smile because that emotion doesn't leave you when you have Alzheimer's disease. After you do that, you can talk to them and get their confidence, and you'll be able to provide care for them. Another condition that can affect older persons are Parkinson's disease. This is a degenerative disease of the central nervous system of the brain that affects movement. It may also affect cognition, and a person's movements may become frozen or shaky. There is also an increased risk of aspiration during treatment, so if you're helping that person brush their teeth, make sure they're in an upright position and you limit the amount of water that's in their mouth at any one time. This person on the left is controlling their shaky hand with their good hand so they can eat. It's important to have your supplies and your setup at hand at the bedside. This way you won't need to interrupt treatment in order to provide proper care. Automated toothbrushes can be very useful. The reason is they give a lot of action per unit of time you put in their mouth, and the person might be able to manipulate it across their teeth better. You should be careful when using an automated toothbrush to be sure that you put the toothpaste on the brush and then put it in the mouth instead of starting it beforehand. There are different types of automated toothbrushes. Some have round heads and some are more toothbrush oriented. However, both are good and be able to provide a good amount of cleaning. People with conditions such as arthritis or Parkinson's disease may not be able to hold a toothbrush normally. In those cases, it's very handy to modify the toothbrush. There are ways of doing this. You can buy them on the internet or in drugstores. They make the toothbrush handle bigger and allow them to be able to manipulate the toothbrush better. Finally, it's important to be observant and communicate. You may be the person as a caregiver who sees that individual more than their family members even. If you see something going on, make sure you tell a nurse or a doctor, because it's important to let them know that there are some changes that you are aware of that they may not be able to see themselves. Thank you very much for watching this video, and we hope that you'll be able to get some information that you find helpful in helping others with their care.